A caesarean section is an operation to deliver your baby through a cut made in your abdomen, tummy, and uterus, womb. The cut is usually made across your abdomen, just below your bikini line. Today's lecture will describe what will happen if your baby is born by a planned caesarean section, from the time the operation is booked to the early days after the birth. Planned caesarean sections happen after 39 weeks unless an urgent medical need is needed before this time. Sometimes we have to change the date of your caesarean section at short notice due to emergencies. We appreciate that this would not be ideal for you and your family, and we only do this if we have to. The pre-caesarean section visit. A preoperative appointment will be made for you in the week before your surgery. During this appointment, an anesthetist will review your medical history and discuss the anesthetic choices with you. They will also talk to you about the risks of each type of anesthetic. During the COVID pandemic, an anesthetist will hold this appointment remotely. An anesthetist will also advise you on the self-isolation measures you must follow before coming into the hospital for your surgery. A member of the maternity team will discuss with you what to expect on the day of your surgery and in the first few days after your surgery. Preparing for the operation. Fasting. Fasting is essential before an operation. If you have anything in your stomach whilst under anesthetic sedation or have an epidural spinal anesthetic, it might come back up and get into your lungs. If your caesarean is in the morning, you must not eat anything after 2 a.m., but you may drink water until 6:30 a.m. Do not eat or drink anything after this time, including chewing gum or sucking sweets. If your caesarean is in the afternoon, you may eat breakfast before 6:30 a.m. and drink water until 11 a.m. Do not eat or drink anything after this time, including chewing gum or sucking sweets. On the day of the operation, please come with your birth partner and overnight bag to the delivery suite in the hospital at the time arranged at your preoperative assessment appointment, either 7:15 a.m. or 11 a.m. Please leave all jewelry and valuables at home, as we do not have anywhere safe to keep them during your operation. If you wear a wedding ring, we can secure it with some surgical tape wrapped around it. Please make sure you remove all nail polish or false nails before coming in, so that we can use your fingers to monitor your heart rate. If you wear contact lenses, you can keep them in or wear your glasses. However, these will both need to be removed if you need to have a general anesthetic. Please note that though it is unlikely, you may have to wait if an unexpected delay has occurred, but we will keep you informed if this happens. You will be prepared for theatre when there is a bed available. To reduce the chance of infection, we will shave the top inch of your bikini line just before the operation. This is the area where we will make the cut to deliver your baby. We will also give you elasticated stockings to wear, called TEDs, which help to prevent blood clots. The team looking after you will introduce themselves to you. They will then check your baby's heartbeat using a handheld instrument called a sonic aid or Doppler. The anesthetic. When the time comes for your operation, you will be taken to theatre or an anesthetic room. The doctor that will give you the anesthetic is called an anesthetist. The anesthetist will set up an intravenous drip into a vein. This is normally put in your hand or arm. This allows us to give you fluids and medication more easily during the operation. If you are having a planned caesarean section, the most common anesthetic used is a spinal block. This makes you numb from your breasts down to your toes. This will last for 2 to 3 hours, throughout the operation and for some time afterwards. If you want your birth partner to be with you while we put in the spinal block, please let the anesthetist know. Some hospitals sometimes combine the spinal block with an epidural. The epidural is a small plastic tube that is inserted into your back. It can help us to give you pain relief after the surgery. The anesthetic procedure usually takes a few minutes to perform and about 20 minutes to become completely effective. Your blood pressure, heart rate and the amount of oxygen in your blood will be monitored throughout the anesthetic and operation. If you feel sick or lightheaded at any time, please tell the anesthetist. This may be caused by a drop in your blood pressure, which can easily be treated. The operation. When the anesthetic has taken effect, a small tube called a catheter will be inserted into your bladder. This keeps your bladder empty during the operation. It will normally be kept in for between 6 to 12 hours following the operation. Your birth partner will be given a theatre gown and hat to wear and can join you in theatre. They can bring in baby clothes, a music CD to play during the operation and a camera. You can take photos and videos of you and your new baby when they have been passed to you. You can also choose whether you want to watch the birth, but if you wish to film or photograph the actual operation, you will need permission from all members of staff beforehand. Please discuss this with the team on the day of the operation. There will be a midwife in theatre and a piece of equipment called a resuscitator, which provides heat and oxygen if your baby needs help with their breathing. There will also be a member of the newborn care team in theatre if we know that your baby may need extra care after they are born. The doctor that will perform the operation is called an obstetrician. When the operation is ready to start, the obstetrician will make a cut through the lower part of your abdomen. You may feel a lot of pulling and pressure, and your baby will be born a few minutes later. Our aim is to delay clamping the baby's cord for 1 minute after the birth. Your baby will then be weighed and dried, then either placed on your chest, wrapped in a blanket or skin to skin, or passed to your birth partner. If you would like skin-to-skin contact with your baby, we will usually put a nappy on them after they have been weighed, but if you would prefer, we can leave your baby naked. The anesthetist will then give you an injection into your vein to help the placenta, sometimes called the afterbirth, to deliver. It will then take a further 30 to 40 minutes for the doctors to complete the operation. You will be offered a pain-relieving suppository at the end of the operation, to help when the anesthetic wears off. A suppository is a solid form of medication that is inserted into your rectum, bottom. The suppository melts inside your body and the medication is absorbed directly into your bloodstream. If you need to have a general anesthetic, you will be put to sleep and your birth partner will be taken to a waiting room nearby whilst the operation is carried out. Your baby can be brought straight out to them while you wake up, if they don't need extra care after they are born. After the birth, you will be moved onto a bed and we will lay you on your side with your baby wrapped or skin to skin next to you, unless they need additional care after they are born. You will be taken to the recovery area for the next few hours, while we check on your recovery. When you are settled in this area, your baby can have their first feed. The maternity staff can help you with this. After around 3 to 4 hours, the anesthetic numbness will wear off. We will give you pain relief to help relieve any discomfort you might feel. Please tell your midwife when you start feeling uncomfortable, rather than waiting for the pain to get severe. This will help us to keep your pain under control. You can drink water straight away, but it may be a few hours before you feel like eating. You will have heavy vaginal bleeding for the first 24 hours, as you would have after a vaginal birth. Once the anesthetic has worn off, you will be helped to get up and out of bed. Once you are able to move around by yourself, you will be taken to the postnatal ward. Remember that everyone recovers at a different rate. You have had major surgery and need to take things slowly. To help prevent blood clots from forming, you will be prescribed an injection of low molecular weight heparin, which will thin your blood. You will need to have this injection for at least 10 days. You may have to have heparin injections for longer than this if you have other medical conditions which increase the chance of you developing a blood clot. You will also need to continue wearing the elasticated stockings while you are in hospital. Enhanced recovery after caesarean section. Most women stay in hospital for 1 to 2 days after a caesarean section. If you are cared for under the enhanced recovery program, you are likely to have the opportunity to go home as early as 24 hours after your caesarean. If you are fit and healthy and your surgery is straightforward, then you will be asked whether you would like to follow the enhanced recovery program. You will be given pain relief and you will be supported to get up and around as soon as you feel ready and comfortable. Enhanced recovery has been introduced in several UK maternity units and has enabled women to recover more quickly with higher satisfaction rates, compared to standard recovery. Looking after your wound. When you return home, you should look after your wound by keeping it clean and dry. There is a 1 in 10 chance of your wound becoming infected after a cesarean section. If you notice any redness, oozing of blood or pus, pain, or an offensive smell from the wound, please contact your midwife or GP. You will notice a loss of feeling, a sensation in the area around the scar. This is normal after a cesarean section and may last for several months, but is not likely to be permanent. Risks and side effects of cesarean section. Your doctor or midwife will have discussed with you the reasons why your baby needs to be born by cesarean section. They will also discuss with you the chance of problems that can happen during this operation. If you are having a cesarean section because of a problem that has developed during your pregnancy or labor, or because of a pre-existing medical condition, your risks may be different. Your midwife or doctor should discuss these with you. Side effects of having a cesarean section. A longer hospital stay, 1 to 2 days on average, compared with a vaginal birth. Pain after the operation. We will offer you regular pain relief to help with this. The main risks to you are excess bleeding, infection of the wound or lining of the womb, developing a blood clot, injury to the bladder, ureters, the tubes that connect the kidney and bladder, or the bowel. The main risks to your baby. Babies born by cesarean section are 4 times more likely, 4 in 100, to be admitted to the neonatal unit with breathing problems compared to 1 in 100 following a vaginal birth. There is a small chance that your baby may be cut during the operation, when we make the cut across your stomach. There is an increased chance of your baby developing asthma, allergies, obesity and diabetes in childhood. Other risks are rare. Please see the Further Information section of this leaflet for more details, or ask your doctor. Risks from the anesthetic. There is a very small chance of complications from the anesthetic. This will depend on the type of anesthetic used. You will be given a separate leaflet about the anesthesia we use for cesarean sections. Please speak to the anesthetist if you have any questions. Pain relief after a cesarean section. In the first instance, the pain relief medications we recommend after a cesarean birth are paracetamol and ibuprofen. If you still have moderate or severe pain or for some reason are unable to take paracetamol or ibuprofen, we may suggest using an opiate such as dihydrodeine or oromorph. We no longer recommend using codeine, as national guidance has highlighted potential, but very rare, problems if you are taking codeine while breastfeeding. Although there have been no reported concerns about dihydrodeine or oromorph, any opiate can pass to your baby through breast milk. This means in theory, it is possible that taking an opiate could cause your baby to be more sleepy, have difficulty breastfeeding, have breathing difficulties and to become floppy.